Alpha-1 antitrypsin deficiency is a rare genetic disease that affects both the liver and the lung. Alpha-1 antitrypsin is a protein that is made by the liver and travels in the bloodstream to various parts of the body, including the lung. When we are exposed to irritants such as cigarettes, smoke, or have a bad cold, part of the body's defense mechanism is to help fight that infection or irritant with inflammation. If that inflammation just keeps on going and doesn't stop, we end up with damage to the lungs and emphysema. Alpha-1 antitrypsin is an antidote, if you like, to that. It stops the inflammation and then stops the damage to the lungs. The Alpha-1 antitrypsin is made in the liver, as I said before, and the genes that control the production of Alpha-1 antitrypsin are defective in Alpha-1 antitrypsin deficiency. So you don't make the protein, so it doesn't travel to the lungs and protect the lungs. The other problem is the abnormal protein that is made in the liver sits inside the liver cells, crowds them, and stops the liver from functioning properly. So the liver can then get inflamed itself with the abnormal protein and develop scarring and end-stage liver disease and liver failure. Some people with Alpha-1 antitrypsin deficiency, if they get scarring or cirrhosis of the liver, are also susceptible to liver cancer. Alpha-1 antitrypsin deficiency is a genetic disease, so it is passed on from the parents to the child. To get Alpha-1 antitrypsin deficiency, you need 2 defective copies of the Alpha-1 antitrypsin gene, and you usually inherit one from the mother and one from the father. People who have only 1 copy of an abnormal gene, like the mother and father, and 1 copy of the normal gene, don't have any symptoms, so they wouldn't know that they had Alpha-1 antitrypsin deficiency. It's only when 2 such people get together and have a baby and that the defective gene from each parent is passed on that the child will get Alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin deficiency is usually diagnosed with a series of tests, but the initial one is a blood test which measures the abnormal protein and the type of abnormal protein. Alpha-1 antitrypsin deficiency can present at any age, so it can present with liver disease as a baby, with jaundice and failure to grow, or it can present later in childhood liver disease or even in adulthood. It can also present with lung disease or emphysema, and that usually occurs in adulthood. Once somebody presents with symptoms suspicious for Alpha-1 antitrypsin deficiency, the diagnosis is made with a blood test which measures the abnormal Alpha-1 antitrypsin protein in the blood. The treatment for Alpha-1 antitrypsin deficiency depends on which organ is most affected. So if the liver disease is the predominant problem, then the person will undergo treatment for liver disease. This includes support with fat-soluble vitamins and nutrition, monitoring the liver for scarring and for something called portal hypertension, and also looking for the development of either cancer or liver failure. If the disease involves predominantly the lungs, there is a treatment that involves Alpha-1 antitrypsin made from other people's blood, which can be given as an infusion for people with very severe lung disease. Very recently, in fact earlier this year, there was a very exciting article published in America from Philadelphia where they have managed to correct the gene mutation in 9 patients with Alpha-1 antitrypsin deficiency. So they used gene editing technology, which involved an injection into a bloodstream of a little particle that travelled to the liver. Inside the particle was a mini gene decoding machine which travelled to the defective gene, found it and corrected it. So this is extremely exciting news and paves the way for correction of such mutations in the future. And the earlier that happens, the less likely there'll be any kind of disease at all. Many people with Alpha-1 antitrypsin deficiency lead very normal lives, have very minimal disease. The main things that they do is avoid cigarette smoke, either primary cigarette smoke, i.e. not smoking, but also not being in a household where other people smoke, and paying meticulous attention to infections and making sure that they don't drag on for a long time. So perhaps earlier use of antibiotics for respiratory infections. People would also need to be in regular contact with their gastroenterologist and respiratory physician to look after both the lungs and liver and monitor for any effects of progression of the disease in either of those two body organs. Alpha-1 antitrypsin can be a confusing condition, so if you need more information and support, I would suggest that you look at the Liver Foundation website, where you'll find some clearly explained information on the condition and its treatment. It's also important, because it is a variable condition, that you speak to your own doctor, because they will know how you're affected and what you're likely to need in the future. There's also excellent patient organisations. A particular big one in America is called Alpha-1 Foundation, which is a parent and patient organisation that both provides information and funds research.